In very simplistic terms, radiation therapy is high energy. And that high energy works at the molecular level to damage cells, specifically cancer cells, so they can't divide. Cancer cells can't repair from the effects of radiation, but normal cells can repair. So we use that to our advantage to destroy tumors with radiation.
You can have side effects related to radiation, but they are totally dependent upon where the radiation is directed. So if we're radiating your breast for breast cancer, there might be skin side effects. If we're radiating your abdomen, there might be some nausea.
You know, in the modern era, we have so many medications that control so many side effects from radiation therapy that the quality of life during a course of radiation therapy is better than it's ever been.
We all know it's a very nervous time for our patients, so we're really trying to get people to be comfortable, ask questions whenever need be, and we can help get them through any questions they may have and, hopefully alleviate any anxiety.
Consultation is a period where we meet our patients and talk to them about the potential need for radiation therapy and the indications for radiation therapy and potential side effects and risks and benefits of going forward with a course of radiation therapy.
I encourage people to actually bring a friend or a significant other because if you're concentrating on transcribing everything that the nurse or the doctor says, you're going to miss a lot of the information.
Simulation is the procedure wherein we gather the information we need to create a treatment plan in order to deliver radiation therapy to the targeted site and to protect the normal tissues. The patient is in this room for approximately 40 minutes.
The patient will come into the simulation room and they'll be positioned on the treatment table in a position that the doctor has requested, as well as a position that's comfortable for the patient. We will place a couple marks on the patient's skin using just a marker. Once we have decided that those marks are in a good place for the doctor to plan his treatment, we'll actually give little tattoos in the place that we've drawn those marks on the patient's skin. The tattoos are permanent, but it is really small, like a little tiny freckle, and usually most patients don't even notice them or can't find them.
The tattoo allows us to deliver the radiation very accurately with each treatment.
Once we determine a comfortable, reproducible treatment position, we sometimes have to immobilize our patients to help make sure that they stay in the same position, and we do that by using some cradles we can form. So we will be making those cradles during the simulation process. Once those cradles are made, images are taken.
The data that's acquired from that procedure then is transferred to our treatment planning computers where we will recreate them in 3 dimensions and design entry and exit points for the radiation.
There is a fair amount of work involved in designing a treatment plan that's specific for a patient. Every patient is different. The location of the disease in every patient is different. The surrounding normal tissues have to be protected. So designing a treatment takes quite a bit of work. It takes time to make use of the data that was taken with CTs, MRIs, PET units, etc.
It could be anywhere from a few days to 10 days. Each plan is customized for each patient. And then once the plan is complete, there are second checks that need to be done and quality assurance to ensure the safety of the patient.
The next step is the verification process. Our patients are going to come in and have everything verified on the treatment table so that everything that's done in sim matches what has been planned.
We bring the patient into the treatment room. We line them up with the tattoos that we've given them on the simulation day. And we just take x-rays from different positions and make sure that the patient is lining up properly according to what we've determined during the simulation. The verification day generally takes about 15-20 minutes. I would recommend a patient to plan on a half an hour just in case we do need to make little minor adjustments.
It really is ensuring the safety and accuracy of treatments of cancer patients that are getting radiation therapy.
During the treatments, you won't feel anything. You may see the machine rotating around you. You hear the machine buzzing at times when it rotates around you. Sometimes you'll hear odd pops and clicks. But nothing to worry about, nothing will touch you, and you won't feel anything.
The therapists do have to leave the room in order to acquire the images. We're monitoring our patients on cameras. We have 3 different cameras and we can see each different angle. We also have an intercom system in which we can hear the patients and we can also talk to the patients. Most of our patients come for 6 to 8 weeks of the radiation therapy on a daily basis.
The treatments vary in length based on what treatment machine you're on, but they're often anywhere from 3 minutes to 7 minutes.
You know, radiation therapy is a very powerful therapy, and you can develop side effects, so it's very, very important for the radiation oncologist to monitor your side effects at least once a week. And certainly if things change in between visits, we always encourage patients to mention it to the nurse or doctor so we can see you in between treatments. Almost always you'll come back about 4 to 6 weeks after the radiation therapy is completed to monitor your recovery from the side effects and to get an early understanding of where you are as far as your recovery from the cancer. And oftentimes we follow people for many months and years after the course of radiation therapy.
After our patients are finished with their treatments, they've had many days with us, and even though they're very glad to be finished with their radiation, usually it's a little teary moment for us and the patient as well, because we're going to miss them and we had that time to get to know them throughout their course of treatment, and it's very much of a celebration for them.